Good morning. Hold on, wait a minute. Let me do a proper introduction so you can see my eyeballs. Good morning, everyone. It is October 17th, Thursday? Yes, Thursday. Can you tell my days are just all blended together into one long day? I am getting ready to go for another fill in my expanders. So I'm gonna get on the road and I'll see you in the next clip. Okay, I'm in the procedure room again. This will just be a quick room tour, and then we're gonna get started with a fill on my expanders. There's my little cake pop flowers that I love. And over here is all the stuff laid out that they're gonna use to access my expanders and then do a fill. And I'll check in when I'm done. So I'll see you in the next clip. Okay, so I did 40 cc's this time, and I think I'm pretty much at where I want to be as far as size goes. This is what they're looking like, and they're still not like projecting a ton, but they're like pretty much where I want them. So we'll do a couple more fills just for skin, and then I'm done. So I'm gonna check in from the car, and I'll see you in the next clip. Okay, so I'm walking to the car, but just wanted to check in. All I have left this week is a blood work appointment, which is tomorrow. So I'll take you along with me on that. And then I think that's it. I'll have to check my little navigator app that keeps all of, or my chart is what it's called. It keeps track of all my appointments, thank God, or I missed probably half of them. But that's it for now. So I'll see you tomorrow. Good morning. Today is Friday, October 18th, and I am getting ready to go get my blood work done. Got all my paperwork here, even though I think they send it over electronically. I just like to take a paper copy just in case, because my luck, I'll get there and they'll say, we don't have it. And then I just wasted my time for nothing. All right, so I'm gonna get on the road and I'll see you in the next clip. Okay. So I just got my blood work done. I was actually early. My appointment was for 10 a.m. But I'm like, you know what? I'm out. I dropped my daughter off to school. I'm just going to go early and just be a walk-in, even though I have an appointment. So they were able to take me back early, which is cool. Yeah, so that's pretty much it for this week. Next week, I have another fill. And I actually have a lot going on next week. I'm getting my first zoledronic acid infusion. Right? Is it called an infusion? Yeah, infusion. I will be getting Zometa. It is a bone strengthener treatment for breast cancer and for the side effects of being on hormone therapy, just to help strengthen my bones. I'm a little nervous about it and the side effects of it, of course. But the main thing I'm worried about is necrosis of the jaw or necrosis of your femur. Your femur, like the biggest bone. I think it's the biggest bone, right? Or it's the second biggest bone in your body. But supposedly that only really happens, it rarely happens, but when it does happen, it happens to patients who are getting Zometa monthly for consecutive months for a couple of years, or even up to a year to 5 years or whatever. I'm only getting it now, and then I won't get it again for 6 more months. And I think they're only going to do that, I want to say 2 years, maybe. I'm not sure. I don't know. I'll check back on that. But I don't know. I am a little bit nervous about it. So we'll see. I'm worried that like a common side effect right after you get it is to feel like you have the flu. And I will be getting it next Thursday, October 24th. And the next day is the 25th. It's also my daughter's field trip for school. We're going to the pumpkin patch like early in the morning. And I'm hoping I don't feel like I have the flu from a side effect. So we'll see. There's just a lot going on next week now that I'm sitting here thinking about it. What else? So I have the fill, I have another Zoladex injection, and in the same sitting, I'm getting the Zometa infusion. So, sorry, I had to just check my chart real quick because I'm like, wait, do I have 3 appointments in the same day? I don't. So next Wednesday, the 23rd, is another fill. Next Thursday, the 24th, is the Zoladex injection and the Zometa infusion. Just to clear that up. It's my brain. I'm just doing this for my brain and my accountability and my brain. But yeah, that is it for this week. I'm going to probably combine this week and next week together since this week wasn't very exciting. So I will see you next week for my next fill. Good morning, everybody. Say good morning, everyone. So if you watch Bluey, the dad bandit sings that in one of the episodes. Anyway, good morning. It is Wednesday, October 23rd, and I'm getting ready to go for another fill appointment in my expanders. So let's get on the road, and I'll see you in the next clip. Okay, so I'm in the exam room. I'm gonna give you a quick room tour. Hold on, where's my picture? Oh, it's behind me. Cherry blossoms. I'm like, it's so pretty. And I'm in my giant circus tent. There's my body. Here's the gown. It's always like ridiculous. I feel like I'm in like a circus tent or a hot air balloon. But anyway, room tour. Let's do the room tour. That's where I'm gonna sit. And over here is where they have all of the stuff that they use to access my expanders. They go through the port. It's a self-closing port, and they fill it with a cute little butterfly needle with a tube with saline. So I'm gonna see if we can do 40 cc's today. I'm gonna see what she says. So I'll see you in the next clip. All right, so I just got a fill and we did 40 cc's this time. I'm gonna skip next week just to give my skin a chance to stretch out, unless it feels okay. But for now, I'm planning on skipping next week because then I'll have the whole week off. I won't have to go to any doctor appointments, and it's Halloween, so I want to like enjoy that with my daughter. She's having a little parade at her school. It's so stinking cute. So I just want to like not have to worry about doctor appointments next week. But anyway, I just want to show you how they're looking. Looking good. We got some projection going on here. This is the radiated side, so it's rock hard, tight, but looking good. Now, this is the size I'm content with, so I'm only doing another fill or 2 at the most, just for the skin. So, and then I'm done. And then it's surgery time. All right, I'm gonna check in from the car. I'll see you in the next clip. All right, I am back in the car. So just to check in real quick, I have a Zoladex injection scheduled for tomorrow morning. And I originally was supposed to have a Zometa infusion as well in the same chair as the Zoladex injection. But guess what I did? I asked to move it because I have a lot going on this weekend and I just didn't want to risk having any potential side effects from the Zometa, since it's my first time getting it. You can feel flu-like symptoms for a day or a couple of days, or bone pain. Some people are totally fine, and watch, I'll probably be somebody who's totally fine, but I just didn't want to risk having those side effects, because tomorrow's Thursday, so I would have gotten it tomorrow. Friday, my daughter is having a hayride pumpkin patch field day at school, and I'm going to it. So, oh my God, I was looking at this. I'm like, what is that? Is that gummy worms? It's a Pop-It. I'm here. My child's always bringing toys in the car. Anyway, I didn't want to risk feeling yucky and not be able to go to that, or let her go to that, because I'm driving her there. So I'm moving it to next week. Also, I just have so much going on. There's a trunk or treat Friday night, and then she has karate and soccer and all these other things going on that I just didn't want to risk it. So I'm moving that out a week or two. I'm waiting for Infusion to call to reschedule that, but I'm going to check in with you tomorrow for my Zoladex injection, and then I'll close out this video. So I will see you tomorrow. Good morning. Today is Thursday, October 24th, and I'm getting ready to go get a Zoladex injection right into my gut. And I think I'd explained it in the last clip, but I moved my Zometa appointment to November something. I don't know. I moved it 2 weeks out because next week's Halloween, and I don't want to feel yucky for that either. And with like our scheduling and the timing that they have available, it just didn't work for next week. So we bumped it out, I think 2 weeks. I forgot. But I'm going to get on the road, and I'll see you in the next clip. Injection. I'm going to show you my little band-aid here. Whoops, right there. And now I'm going to say hi to my dog Coop, and I'll check in from the car. So I'll see you in the next clip. Okay, I'm back in the car. And before I say anything, I realized in my vlogs, I haven't said this in a long time, but this is your daily reminder to stay hydrated. So whether you are on cancer hormone therapy, or going through chemo, or going through radiation, or you're just a living, breathing thing, it's very important to stay hydrated. It helps our bodies flush out the toxins, and it helps your organs and everything to just be functioning properly. And if you don't know why, Google it, because you need to stay hydrated. It's just, it does the body good, trust me. I wouldn't steer you wrong. All right, so that is pretty much it for this week's vlog update. The injection went really well. I rescheduled my Zometa, so that's like my next big thing. But guess what? Next week, I'm off. I don't have any doctor appointments at all. I get to enjoy Halloween with my daughter. I get to just chill, which is so cool. I can actually like get caught up on stuff, maybe do some more YouTube videos that are not vlog related. So I'm very excited about that. Another reason why I rescheduled my Zometa, and I wasn't sure if I was going to tell you guys or not yet until afterwards, but I was asked by MD Anderson Cooper if I would be interested in sharing my survivor story at the Pink Roses and Teal Magnolias event this Sunday, October 27th. It is a brunch. It is a couple hours long. They will be giving out some awards and recognizing certain oncologists and doctors that they're just giving an award to and recognizing for their hard work and dedication and all of the things. I'm not exactly sure, but they wanted to have 2 survivor stories, and they asked me back in August actually if I would be interested in sharing mine. It has been trimmed down to a 5-minute speech, which is really hard for me to do because, you know, number one, I talk a lot. Also, my story is a lot longer than 5 minutes, so I'm like, I wanted to thank MD Anderson Cooper for asking me or inviting me to share my story with everyone. Also, I wanted to mention my YouTube channel to help anyone who might be in the audience that day. Maybe they could refer their loved one to my channel, or just themselves will go to my channel and watch my whole journey if maybe they're just starting out theirs. And I wanted to tell my story and try to give some hope and inspiring words of love during my speech, but trying to do all of that in 5 minutes. So wish me luck. I already wrote my whole speech out, but I hope it touches some beautiful souls out there. That's really just my goal. And I hope I'm not like a nervous Nelly the whole time or having a hot flash during it, because that'll be my luck. But that was why I rescheduled. It was part of why I rescheduled my Zometa, because I didn't want to feel any side effects. If I was going to have a side effect from it or any type of a reaction from it, I didn't want it to happen this weekend because it's a very important weekend for me. And I will be recording that. So I will be doing a video of my experience and my speech with Pink Roses and Teal Magnolias. Can you tell I'm a little nervous? Just a little bit to be on stage. Hopefully there's a podium so I can like brace myself and not fall over. And yeah, I was gonna wear a wig, and then I decided I'll just wear my hair like this because I want people who are maybe beginning their chemo journey, maybe they haven't lost their hair yet, or they haven't done anything yet, they just found out they have breast cancer or even ovarian cancer, what it looks like when your hair grows back. So this is like almost, well, actually it is a year out from chemo, because September is when I lost my hair last year. So this is a year. Anywho, so that's it for this vlog. Make sure you are subscribed to my channel because I will be putting more videos out very soon, and keep checking back because the video for Pink Roses and Teal Magnolias will be up probably next week. I'll have it all edited and looking nice. All right, I hope you are having the best day. Thank you so much for being here with me on my journey. As always, I love you guys so much, and I better see you in the next one. Bye, everyone.